That is her MRI for which we are going to give a selective nerve root block on left side, as she is having symptoms on left side. This is a L3-4 level, which is a normal level where we can see the dural sac in central position. That is a lateral recess on right side, that is a lateral recess on left side. That's the exiting root, which is a L3 root here right side, and this is a L3 root on left side. If you come down at L4-5 level here, if you see, that's the dural sac central part, that's the right lateral recess, slightly compressed, mild stenosis we can say, and on left side there is a significant stenosis, because of which she is having significant pain on left side, intermittent, and she needs to take analgesics for that, for which we are going to give the selective nerve root block. And that's the exiting root here on left side, which is a L4 root and which is not compressed, it is already exited, and that's the L4 root on right side, which is also exited and it is not compressed. The local anesthetic, we have taken a lignocaine 2% in a 5 cc syringe. Then we need a radio opaque dye. This is a iohexol dye, and we have taken it in a 2 cc syringe, and volume is 1 cc. We not need this much volume also. We have taken 1 cc in this. Brand name of this is Optiscan 300, which cost around 354 rupees. So, and you can use this multiple times, and you can store that in your refrigerator in sterile condition. And this is a 5 cc syringe in which we have taken 0.5% of bupivacaine 1 ml, and then injection kinacot, which is 40 milligram, and total volume is 2 cc, and then in a 23 gauge spinal needle. In the beginning, when we take the dead AP view, our normal AP view, without squaring of the vertebrae, you can see that if you see here in this particular position of the Siam, L5 is not squared. If you see, we cannot see the end plates of the L5, and the pedicles of the L5s are not clearly seen. We are going to tilt the Siam, and we are going to do the squaring of the vertebrae, which is very important for giving the selective nerve root block. She is having pathology at 4-5 level. We are going to target the L5 root here. So we are going to put the needle here. In our this particular Siam, this side is a left and this side is a right side. Now we have tilted the Siam to do the squaring of the vertebrae. Now if you see in this particular image, in this current shoot, so we can see the end plate of the L5 very clearly, and end plate of the L4 also. So our target is to hit this foramen, and by going here we are going to target the L5 root, which is whose shoulder is here, disc protrusion here at L4-5 level, and this root traverses from here and then exits below the L5 pedicle. Now this lady is having left leg pain, so we have tilted this end towards left side to get the good view of that foramen, and now we are going to inject the local on the skin. After giving local anesthesia, then we are going to put the 23 gauge spinal needle under Siam guidance. Shoot. 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 Okay. In lateral position, that's the body of the L5 vertebra, that's the pedicle, and that's the needle, and this is a foramen from where the L5 root is going to exit. And this is the L4 vertebra, that's the pedicle of the L4 vertebra, that's the foramen of the L4-5 level, and from here the L4 root is going to exit. So in this particular case, pathology is at L4-5 level, where disc is protruded or herniated, and which is causing compression of the L5 root at this level, where L5 root is traversing, and it is going to exit below the L5 pedicle from here. So we are going to target the L5 root at exiting level, and from which we are expecting that drug is going to travels towards the disc where the pathology is. That's the tip of our spinal needle, where it should be in the foramen, from where the L5 root is going to exit. Now radiographically we are correct, and now we are going to inject the dye, which is the iohexol, and it is not compulsory every time when you are going into the foramen that patient should get a leg pain. If you are radiographically correct, then you can confirm it with a dye. That's we are pushing the dye. Shoot. That's the spread of our dye along the L5 route, and it is going to go traverse towards the disc where the root is compressed. Shoot. Yes. So we have injected around 0.5 to 1 cc dye, which is good enough, and it is already traversing towards the L4-5 disc where the pathology is. That's the mixture of triamcinolone and bupivacaine. Total volume is 2 cc, and we are going to inject it. Every time we should aspirate and confirm that we are not into the any vessel. That's the needle, that's the spread of the dye along the L5 route, and the dye is going along the L5 route towards the disc where the pathology is, where the root is compressed. And if you see, after injecting the drug along that route, it has already spread towards the L4-5 disc. If you see this is a dye, and it has diluted because of giving the drug and bupivacaine. So that's the end of our procedure. Whatever technique we have shown just now, it is called a subpedicular approach for giving the selective nerve root block. We have given the selective nerve root block for the left L5 root, and we have injected the drug below the L5 pedicle because it was compressed in the paracentral region or lateral recess. But if it is a foraminal disc or extraforaminal disc, then we have to give the injection at the same level. MRI of a different patient where there is a foraminal disc and compressing the L4 root at L4-5 level. There is a listhesis also in this case. Obviously we have not given block for this patient, and we have did the TLIF or transforaminal lumbar interbody fusion in this case. Now this is a L3 and L4 level where this is a dural sac, this is a right lateral recess, this is left lateral recess, this is a exiting root which is a L3 root, and this is a left exiting root, that is a L3 root. And if we come down at L4-5 level, then you can see that there is a significant disc fragment in the left foramen which is compressing the left L4 exiting root here. Right L4 exiting root is clearly seen, but left side there is a big disc fragment. And if we scroll on the sagittal images here, then if you see on the right side, you can see clearly this L4 exiting root, but if we go on the left side, then there is a big disc fragment which is correlating with the sagittal images. So if there is a foraminal or extraforaminal disc, in such cases the block should be given at the same level. That means if it is a L4-5 foraminal disc or extraforaminal disc, then block should be given below the L4 pedicle, so that drug will reach to the affected root which is a L4 root. Thank you.